much, everyone, for being here today. This is our 43rd news conference since the coronavirus pandemic broke out. Mayor Demings is here to talk about the trend in the COVID outbreak and also to give you an update on CARES Act funding. Mayor Dyer, unfortunately, still has his city council meeting going on right now, so he will not be able to join us today. Dr. Pino and his staff have been working 7 days a week to combat the coronavirus. He's here to talk about testing numbers and a look at what this means to our community. And now Orange County Mayor Jerry L. Demings.
Thank you, Jane. Thank you all for being here. Hopefully you had a good weekend. What we're going to do today, I'm going to flip the order again today. We're going to start with Dr. Pino first. I believe that there's some new developments as it relates to stopping the spread of the virus here within our community. Some of the numbers have not been encouraging for us, and consequently, I think that in order to put the appropriate framework around what I'm going to say this evening, I'm going to have Dr. Pino begin and just share with you a little bit about what we are seeing with our local experience. I know that across America and across the state of Florida, there's been some concern or criticism about the numbers and whether or not government has been transparent with the numbers. But what I can tell you is that here in Orange County, it's been a pleasure to work with Dr. Pino. What we try to bring to you each day are the real numbers, the real experience that we are dealing with here within our community. And as such, I feel like we have the responsibility to react appropriately. And so we're going to have Dr. Pino share with you the numbers that he's seeing from the dashboard. He's able to look behind the curtain to see what's going on here. So, Dr. Pino, we'll start with you, and then I'll come back.
Thank you, Mayor. Good afternoon. Today is our 43th press conference. It looks like we started yesterday, but the numbers are rising again, and I will give you an insight of what's happening. So we have 3,282 positive cases in our county. That is for a cumulative of 3.4%. Now that's coming up from 3.0 the last time that we talked to you. And also it's important to know that our recovery rate also has decreased. Of course, as a number increase, our recovery rate now is 66%. Orange County has conducted close to 100,000 tests. That is 96,377. We have negative 93, 0.38. And unfortunately, although it's not reflected in the dashboard yet, we have our 47th death. Our prayers and thoughts with the families of the deceased. Is an 83-year-old male of Asian descent, died the 14th, and it was hospitalized for 15 days. Also, with regard to the latest testing numbers, yesterday we received 2,951 tests. Out of those, 186 were positive. That's the highest number we ever had in a single day. That is a 4.9, 5.9, again, 5.9 positivity rate for yesterday. And on Saturday, we received 3,213 test negative results. We have 167 positive on Saturday. That was also the highest before yesterday. And a positivity rate of 4.9%. There are some characteristics that are interesting about our data. And one of them is that in the last 14 days, our median age have dropped to 30 years old. So the people in our county that are getting infected recently are a lot younger than when the pandemic, at the beginning of the pandemic. And that also reflects on hospitalization data because younger individuals tend to do better than older individuals with pre-existing conditions. To give you an idea of the totality of the numbers, on week 22, we have 176 cases. That was a 9% increase from the prior week. In week 23, we have 242 cases. That was an increase of 38%. On week 24, last week, we have 730 cases, new cases. That's a 202 percentage increase. And this week, and only this week, we have a couple of days, we have already 246 cases. So we could surpass this week, last week. How we compare to the state? Our hospitalizations are about the same rate right now as a hospitalization at a slightly increased. Our healthcare workers affected in our county is only 9.6% of all positive cases. For Florida, it's 11.5. Our fatality rate is 1.42. For the state, is 4.1. And as I mentioned before, our median age for the last 14 days is 30 years old. For the state, is 37. On hospitalizations, we have seen a slight increase. We have been in conversation with the hospitals during the weekend and today twice. They have seen a slight increase in the number of hospitalizations, ED visits, and admissions, very slight, and few cases in ventilators with COVID-19. Only, I believe, 6 individuals right now are in our county on ventilators on COVID, and we have approximately, yesterday is the last day that I have data, about 70 cases hospitalized outside the intensive care units. Now, that is to say, most of those people are residents of our county, but it's possible that in those numbers, there are people who are not residents of our county, as we have regional healthcare system that have the flagships hospitals in our county, so that's possible. With that, I give it back to Mayor Demings, and I will answer any questions that you may want later.
Okay, thank you, Dr. Pino. The numbers that you've heard Dr. Pino share, they've been sobering, to say the least, for many of us. But when you think about it, Orange County having nearly 3,300 cases, 47 people who've died, it's not lost on me that as we are looking at those numbers, that is a significant increase from what we have been seeing. If we go back to the day, June the 1st, on that day, we had 15 new cases. What Dr. Pino just told you was that within the last 24 hours, in one day, we had 186 new cases. So for the last several days, we have seen triple-digit increases in the number of cases here within Orange County. If you're like me, that should be concerning. 2 weeks ago, each day we were seeing a positivity rate of below 3%. What he said to you today was that our positivity rate was 5.9% within the last 24 hours. And so that means that we must do something. Doing nothing is not an option. It's not a good option for us in this community. And so earlier today, I had a conference call with the healthcare experts here in our community. Dr. Pino participated in that call. We had an epidemiologist from Advent Health, and we had physicians from Orlando Health, and we had physicians internal to Orange County. Our medical director, Dr. Zuber, participated in that call. And then we had some other emergency response personnel who were on the call. From that, I said to them, obviously, we don't like the numbers, what's happening here with the increase in our community. So what do we do about it? And there were certain suggestions that came up from that call. Essentially what the group said was that we need to reiterate the need for the public to voluntarily comply with the directives and the guidelines that have been in place, the social distancing and all of those other sanitary measures that we have put in place. So we're going to reiterate that through any of our press events or social media or other means here within our community. They said, secondly, that we should likely explore the potential for mandating the wearing of masks for certain types of businesses. When Dr. Pino looks at the data, there are certain types of businesses that seem to be bubbling up in terms of an outbreak, a cluster of activity. He can tell you that some local bars, nightclub type establishments, when they're doing the contact tracing and looking, we see some cases that are developing from some of those locations. He shared with you that the median age of the individuals who are testing positive has gotten lower, 38 years old. That age used to be much higher at one point, but we're seeing that younger demographic becoming infected because that also happens to be the demographic that is least likely to wear the mask because they tend to be more healthier and they have less of a critical impact on their health when they get the virus. But they can very easily spread the virus throughout our community, and we knew that likely when we open back up, because the virus is still alive in our community, we knew that we would see new cases. What we didn't know was that the cases would begin to spread as rapidly as we're seeing that. Part of our concern is that when we spiked back in April, around April 10th through the 12th, we were really concerned about the second wave, if it would be worse than the first wave. But obviously at the point where we are today, where we're seeing triple-digit increases each day, if we're not careful, we're going to drastically exceed the previous peak back in April. So for me, it is important that as one of the leaders in our community, that we address this in a holistic way. The third thing that I think we have to do is we have to expand the contact tracing within our community, and primarily that is delegated to the Florida Department of Health and Dr. Pino's shop here within Orange County. But I look forward to working with the State Department of Health here locally to better research and evaluate where we're seeing these outbreaks occur so that we can do a laser-like response into those certain communities or demographics where we're seeing the spike. So testing becomes really, really important to us to be able to know how to respond appropriately to the virus. So each week that we start, I tell you that the goals for the week, number one is always stopping the spread of the virus, and that continues to be the primary goal that we have for this week coming up. The secondary goal that we have this week is to better understand the data analytics that is being presented and how we respond to the increase. Thirdly, we will continue to work to take care of the immediate needs of the residents of Orange County by providing funding, crisis assistance funding, through the CARES Act funds to families and individuals and to our businesses. And so there's a bit of good news. This morning, we opened up the county's CARES Act lines, and At 8 a.m., we started that process today, and approximately 25,000 users visited our site. And by 8:53 a.m., so roughly an hour into it, we reached that goal of having 25,000 people access our site. At this point, over 15,000 applications were submitted today alone. The total number of applications submitted so far, these are people who accessed the website, who completed everything for the Family and Individual CARES Act funding. About 19,000 people have completed applications. That's from last week to this week. We intend to open it up again a week from today. We're going to process the ones that we have now and get through those, and a week from today we'll open it up again. Currently there, in terms of the business crisis assistance, we have about 3,800 applications that have been submitted for the business crisis assistance. And there's about $4 million that has already been approved for payments to small businesses in $10,000 grant applications. So I have some staff who are here this afternoon. They've been working behind the scenes to make all of this work. So if you have any questions about the CARES Act funding, how that has gone, then I would ask our staff to assist in responding to that. We continue to give out personal protective equipment here within the community, and that process is going very well. We had testing scheduled today at Barnett Park, and we had some 300 plus individuals who registered to be tested at Barnett Park for free, and we're going to continue those types of efforts within our community. And so with that, I'm going to stop and allow you to ask any questions that you may have at this time, either of Dr. Pino or myself. And with the Spanish-speaking media that may be here today, feel free to ask your questions during the Q&A portion now. And Dr. Pino, if they're Dr. Pino, then he can respond in Spanish. And Ilia Torres over there, one of my special assistants, if I need to respond, I'll respond in Spanish through her. I won't try to limp along and respond to your questions myself directly in Spanish. Although they're teaching me, I've learned pretty good from Dr. Pino in the last few weeks. I've listened very carefully. So with that, any questions?
Yeah.
Yes, sir.
Eric Sandoval with News 6. This question is for you, Mayor Demings. You made mention of this in your teleconference with, the medical team this afternoon or this morning. At what point are you going to mandate the wearing of masks?
I'm studying it right now. I don't know that a blanket wearing of masks, making it mandatory for everybody in every circumstance, is what needs to be done. But it may be more appropriate for certain types of businesses to see that as a mandate. And so we were exploring that with our legal. My concern is that we want to have primarily voluntary compliance, but where individuals are not complying, I want to be a bit realistic about our ability to do enforcement. And I really don't want law enforcement put in that position. And you can understand why I don't want this to be a law enforcement thing. For something that may be a minor violation of law, may be a violation of a rule or a directive, in today's environment, to have law enforcement doing the enforcement, I think creates confrontation And that's not what we're aiming to do. I don't want to create confrontation in this kind of volatile environment that we find ourselves in now. So we have more of a measured approach where peer pressure, is the best pressure that I think we can put on any of them. And we're seeing an abundance of that where we do see, and you being the media, I know you're getting the calls, you're getting the social media posts where you see people just violating the directives and social distancing, et cetera, that is causing part of the problem that we have now. So I don't want to add to the conflict that is going on in terms of police-community relations today. So we will look to other means. We will look to the Department of Business and Professional Regulations that holds the licenses over bars and restaurants, et cetera, as well as some of our local enforcement strategies. But I believe that if we identify teams of people by working with Dr. Pino that can do the contact tracing, if they show up in your business and they start asking you a bunch of questions about your business practices, I believe that indirectly could bring compliance. So I know that we do have to step it up to the next level. The other thing that we will be doing is having conversations across the region about the response, because I believe that what we're seeing here in Orange County isn't unique to Orange County. The numbers are going up across the country, across the state, and they're going up across the region. So I want to make sure that we have some consistency. So we just haven't had time to talk through what that really looks like and what is practical for us to be able to do.
Mayor Lauren Seabrook, Channel 9. Are you considering any kind of plan to possibly go back to some sort of a shutdown, or are you going to leave that to the governor to do on a state level? Would that be something you would do here just for Orange County if it gets too bad?
In terms of where we are today, from talking to the hospitals, we have capacity. Even though they're seeing the number of people who are coming into the hospitals who need to be treated for COVID-19 related illnesses, the numbers of inpatients are going up, the number of ER visits going up. But what they said, the number of patients that's on ventilators, not so much, just a marginal increase there, but they have capacity. If we were seeing where we were about to exceed our local capacity, we would have to do something much more drastic. So because these individuals are younger and tend to be healthier, I think the critical nature of the illness is less on them. And so I'm not the physician, that's Dr. Pino, he's the physician, and he could validate that. He and I have had conversations about it. So the short answer to are we looking today to go back to some mandates for sheltering in place? We're not there yet. This is why we're coming to our residents today and saying that we need all of their help to avoid that becoming a greater probability. Does that answer your question? Okay.
This is for Dr. Pino, Amanda Dukes with WESH TV. Dr. Pino, we keep hearing Governor DeSantis blame this increase in cases, or at least the explanation he gives is there's been an increase in testing. I would like to hear from you, is an increase in testing part of the explanation? But what is the other part? How much of this, in your opinion, could be increased exposure from the economy reopening and people somewhat getting back to normal?
So I can only talk about what's happening in Orange County. I don't know the data that the governor has access to. So yeah, there is an element, and we always said that the more you test, the more you are going to find. In public health, we have a say, if you look for it, you will find it. So, and we have deliberately being engaged in a different type of testing where we really are looking for the positive testing. I have explained in the past that whatever we learn, we have a few cases, we move our testing to that location, we have moved our testing to the hot spots. So we don't have locations. We go around the county basically chasing. So to a degree, that's part of it. And another part is undoubtedly the opening of the social activity. This is a virus that is transmitted by humans. It doesn't crawl, it doesn't swim, it doesn't walk. We take it with us wherever we go. That's why source blocking, source control, this is what is called in epidemiology, is so critical. So even with the social activity, if we were adhering to these measures, we will have some cases, but not this type of jump that we have seen in the last 2 weeks. And coincidentally, and this is just anecdotally, I have seen a decrease in the number of people who are using masks in crowded places, supermarkets, stores, and other venues where you now hardly see people with masks. And we have linked many cases to specific locations, to a specific day where they were not wearing masks and where we got complaints from those places. So there is a mix of everything in the pot. But yes, increased testing, of course, will increase the numbers. But if those numbers will increase proportionally, then the positivity rate will continue to be constant, even if you increase testing. So there is a little bit of everything in the data, but that's true. The increased number of testing will increase inevitably the findings, yeah.
This I know you mentioned that you were. The microphone. Oh, sorry.
Hey, Danielle Lama with Fox 35. This question's for Dr. Pino. I know that the mayor mentioned outbreaks associated with bars and nightclubs. Are you seeing that type of activity at any other businesses or any other events? Could you give us some specifics on what you all have seen?
So I will not be able to mention the name of the locations. I would need legal advice for that one. We have seen in the past that if we mention a name in prior jobs, people can lose their businesses rather quick. What we want, and the mayor mentioned, is compliance and adherence. It doesn't matter if we make it mandatory or not. What we need is the support of the community. What we need is people to use it, even if it's mandatory or not. Source blocking, the mask, hand washing, keeping your distance is critical, especially in places where you are enclosed. And that's what we have seen. Places where people are enclosed and you stay for more than 15 minutes. Those are risk environments, especially if you have a high concentration of individual in a small place. And bar and restaurants are a perfect example of that, of those. Although we have seen place of employment and factories and other locations. And at the same time, from many of these places, we have seen immediate compliance. When we talk to them, they have factories that have shut down. Even at the expense of the economic recovery, they shut down, they do the deep cleaning. But also, I want to give this observation to you and everyone else who is listening. In every single outbreak that we have imposed the use of masks, we see a reduction of the number of cases within a week. And that's why we are insisting so much in wearing the mask. We have seen outbreaks, specific outbreaks in a specific location where we say, please mandate to use a mask. And the number of cases reduced immediately. Now, there's going to be a level of community transmission, and that is expected. And it's a good thing within this news that is in the younger segment of the population. And we have asymptomatic cases in assisted living facilities that we are really watching like hawks. And we have 199 of those facilities in this county. This is a large county. We have 1.4 million people living in this area. And what the mayor was saying about this is a regional problem in the sense that we will do little if Orange takes steps that other counties around us don't take, or vice versa, because as the economy opens, that traffic between the counties is going to increase.
Steve Hudak from the Sentinel. This is for Dr. Pino, but you could chime in if you'd like, Mr. Mayor. Dr. Pino, with these numbers, these testing numbers, with the number of positives, how many folks do you have assigned to do contact tracing, and how are they able to do these many people? This is arduous work.
So we fortunately have in Orange County a large health department. We have 525 employees. Not everyone is dedicated to tracing, but we have been able to move a number of individuals. At the highest point was 22 into trace investigations. We are going to increase those numbers on the weekends because what happened is we are receiving large cases on the weekend, so it really backed up the entire week if we don't have a lot of activity for tracing on the weekend. We also have asked the mayor for additional support. We have presented a proposal to the mayor, and he will look into it. He said he will look into it rapidly so that we can add additional 20 individuals to the trace and tracking investigation units. But this is very arduous work, and you have to interview every single person that you can get in touch with to be able to establish connection between this individual, but also to be establish connection at the source. Can you identify a common source for this group of individuals? And we have identified common sources sometimes for 55 individuals, for 20 individuals, for 77 individuals. So it is critically important that we do trace investigation.
So the only thing that I would add is that we will be working with Dr. Pino and the Florida Department of Health in Orange County to provide some financial assistance to them to be able to hire additional individuals to do the contact tracing. We need that body of knowledge in order to have an appropriate local response.
Hi, this question is for Mayor Demings. This is Emily Braun with News 13, and a lot of this has kind of already been mentioned, but I know that you did bring up the bars and nightclubs as a specific example and possibly looking at mandating that mask wearing. But in the meantime, is there a plan to kind of check up on some of those hot spots that we've seen so far to take a look at the policies that are in place and if they are following those current procedures?
A couple of things. We do get some reports from the community about perceived places of business that are violating the social distancing and CDC requirements. The regulatory authority over those businesses is shared between state agencies and local agencies, and where appropriate, we will do follow-up with those locations. And that is why I say that in terms of a blanket, everybody must wear masks, I don't believe that that's very practical as we are reopening. But if we have specific businesses or types of businesses that we know increase the likelihood that the virus could spread because of the proximity of human beings to one another, the fact that maybe masks because the patrons are eating, drinking, or what have you, but employees are not wearing masks themselves, and those types of things, we want to be able to have an appropriate response to increase the wearing of masks. We need all of your help, the media that's in the room and everyone else, because what we see happening is when we apply pressure to said businesses, they tend to better comply. And if people don't feel comfortable indoors in certain types of businesses, they're not going to go. So we do see a number of restaurants who are thriving where they do have some type of outdoor kind of seating arrangements, and that tends to, I guess, help diminish the spread of the virus. So it's a number of things I think that we have to look at holistically to have the right response for our community. And I'm just trusting that, people will listen. They will hear our plea. And as I said, Friday, I think it was, we don't want to go back to sheltering in place. We saw the significant economic impact that had on our community and the anxiety of our families as well. We don't want to go back to that point. So if people hear what we're saying and they understand why we're doing it, I just believe that good will win over evil. People will hear us and they will do the right thing. So keep doing what you're doing. Keep exposing the ones who are not doing what they're supposed to be doing out there. We'll all be better off. Okay, where's the mic? Okay, it's over there.
Hi, Alibet Suárez para Más 100.7 FM. Mi pregunta es para al alcalde Demings. Básicamente, si nos pudieran hacer una actualización sobre el portal de asistencia, y hay muchas personas que todavía en la comunidad se comunican con nosotros desesperados porque todavía no han tenido la oportunidad de aplicar. ¿Cuáles serían sus mensajes para ellos que puedan tener esta oportunidad de poder aplicar? ¿Qué les ayudaría a facilitar ese proceso?
There's a couple of questions in there, but basically, if you have an update for us in the Crisis Assistance Program, she received a couple of calls from constituents not being able to apply for assistance. So what would be your message to that community?
Okay, in terms of the update for the crisis assistance, I indicated earlier that we will reopen it a week from today. We will deal with the 25,000+ that we have now received, and the staff is working through that very diligently. So if in terms of the business crisis assistance, that still is an ongoing process. That portal is open and you can continue to make applications for the business side. So I'll look to our staff over here. The question is, what will we do with crisis assistance? So, but I forgot, Ilya, I'm sorry. Ilya is supposed to be translating this back into Spanish, so.
El alcalde aclara que el programa de asistencia para individuos abrirá la semana entrante. Ha recibido una cantidad considerable de aplicaciones, así que el personal está trabajando arduamente en procesar todas esas solicitudes de una forma muy diligente con relación al programa de pequeñas empresas o de apoyo para pequeñas empresas. Ese portal aún está abierto y las empresas aún pueden aplicar. Tenemos staff disponible para responder a sus preguntas.
So there are two things here. I know that Commissioner Uribe, Commissioner Gomez-Cordero are here. They've been tracking this very well. And commissioners, do you all have a message in response to her question as well?
Las comisionadas están presentes y se han mantenido actualizándose con relación a este tema. Las invitamos a pasar a proporcionar unos comentarios.
Actually, Mayor, one of the questions that she had was that they have been receiving some phone calls. I have been receiving them as well. People that do not have computer, but they also do not have internet because they have been caught because they didn't pay. What if there is anything that could be, that could fit in for those people? That's what she wanted to ask as well. If anybody can answer.
You want to respond or you want staff?
Yes, staff.
Nina, can you respond? Okay. Sorry to put y'all on the spot, but I know y'all been working on this stuff. So.
So we just wanted to say that for people who don't have internet, are not able to use the internet, or their phone is not able to do it, while the application process is open online, they are able to call 311, and 311 will be able to provide them, take their information, and they'll be able to be provided with a paper application that they can fill out, and it will have a mailing address that they can mail it back to.
Para aquellas personas que no tienen acceso a Internet, hemos estado informando a la comunidad que pueden contactar al sistema 311 los días que la aplicación está abierta, y el personal del sistema 311 le puede dar información, un número de confirmación y un documento para rellenar y devolver por correo.
Es importante que al momento que el portal abra, que se comuniquen con el 311, porque el proceso se va a mantener abierto hasta que el portal se cierra. pero pueden comunicarse con 311 y solicitar su proceso en papel. No es todo el día, es solamente durante el portal se mantiene abierto.
Right here. The next question is text in, Mayor. This one's from Scott Powers with Florida Politics. Orange County has seen its positive rate double from the first week of June to the second. 5.4% of tests for the week of June 8th through the 14th were positive. If the rate continues to climb, is there a threshold where you would consider slowing reopening efforts?
The short answer is yes. I think if we end up back at double-digit types of positivity rates, then we're going to have to, I think, take more significant action.
And from Melissa Thomas with Florida National News. For you, Mayor Demings, the CARES Individual and Family Assistance Grant application is back online. Are there any changes or updates for the CARES Small Business Grant, or any updates you'd like to provide?
Sure. I'm going to ask Mr. Eric Ushkowitz to come forward. He has been managing the process, and so we've made some tweaks to our processes that he's intimately aware of.
Thank you. At this point, what we've done is we've allowed the businesses, if they're missing a document or two, to be able to go back into their application and add those documents rather than having to resubmit. That's the only change that we've made at this point, but we may look in the future at expanding the program criteria depending on the volume that we get in.
Thank you. Ryan Lynch with the Orlando Business Journal. Text in as well for you, Mayor, or Dr. Pino, on elaborating on what could trigger the sort of action when you're talking about slowing down the reopening process. What would make that possible?
Okay, I'll go back to part of what I said in the previous answer, and that is if we get to the point where we have double-digit increases day over day, we're going to have to certainly do something different.
And for you, Dr. Pino, from Jennifer Marcial and El Sentinel, she would like your answer in Spanish, and I think everyone in the room here would like it in English as well. Her question goes, this weekend we got information from people waiting 3 hours to get tested at the convention center site. Some had conditions such as autism and were told they had to wait the long hours. What is the best practice for people to get tested without that long of a wait? And is there any arrangements for people with disabilities or special needs?
So the convention center is not the only site that is doing testing. There are multiple sites around the county that are doing testing, including our county government sites this week at Barnett Park. Those are by appointment, and though it's a lot easier than waiting in line at just, first come, first serve. That would be my suggestion. Also, I believe that if you call 311, it can be also make arrangements for people with disability to get tested, and in some cases, even if they need transportation, and it's justifiable so. La pregunta en español fue que han habido líneas de espera en el Convention Center de hasta 3 horas y que han habido personas con disabilidades y personas con autismo en líneas muy largas, que donde se pueden hacer las pruebas. La respuesta fue que el Convention Center no es el único lugar que está haciendo pruebas en el condado. Hay muchos sitios en el condado que están haciendo pruebas, incluido el condado mismo está haciendo pruebas en Barnett Park. Esos son por appointments y, por supuesto, si tienes una cita a la espera es mucho más corta. So, mi sugerencia para todos esos que necesitan asistencia especial es vaya a un lugar donde puedan hacer una cita y tengan su cita disponible para cuando lleguen.
You, Dr. Pino, from Megan Cruz from WFTV. With the new cases and the age drop, are you able to trace any back to other kinds of businesses or activities like Memorial Day celebrations or protesters? Or is it just mostly bars and nightclubs?
Well, it will be inferred that it's mostly nightclubs or bars. We have been able to trace there because we have a group of individuals that coincidentally has said, that's the only place that I went out. That's the only place that I was that night. And then you have a group of individuals that said the same, and they start, looking for that information. But in reality, it's a wide community distribution. And we don't have to slow down the economy if we use masks. We can prevent it. We did it before. We slow it down to one of the slowest in Florida. We can do it again. It is as easy as putting a mask on every time that you leave your house.
Okay, I'm going to ask Commissioners Uribe and Gomez-Cordero to come forward. They want to share some brief messages with our Spanish-speaking media. Please.
Buenas tardes, Mayra Uribe, comisionada Distrito 3. Algo muy importante que estamos hablando hoy es ser paciente cuando está el proceso de aplicación. Lo que estamos viendo mucho es que el proceso para poner los documentos se tarda mucho. Por favor, cuando la gente se entra en el sistema, que se queden ahí y no se salgan, porque el condado ha dejado el proceso para poder subir los documentos. Otra cosa, el 311, hemos recibido muchas llamadas que le cuelgan, uno no puede pasar. Por favor, siga llamando por ese número, porque estamos viendo ese problema muy grande, especialmente con la gente que habla en español, porque está limitado a la gente que habla en español en esa línea también. So, por favor, no paren de hacerlo, tengan la paciencia y sigan. Y por favor, las máscaras y la distancia. Por favor, le pedimos a nuestra comunidad que seguimos con eso, que estamos viendo los casos subir mucho. Muchísimas gracias.
Gracias, comisionada Maribel Gómez Cordero, del Distrito 4. Quiero decirle a todas las personas que nos están escuchando, la paciencia es bien importante, pero ahorita recibí un email de Randy, él es el Deputy Administrator, y él es el que está sobre todo esto, y él dijo que ustedes vieron que hay una reducción de los documentos que usted tiene que someter, pues no tiene que someter ya el número del landlord ni nada de eso. El dinero va a ir directamente a usted y usted paga lo que usted tenga que pagar de la renta o el mortgage o lo que tenga que pagar de algún bill médico. Así se le hace más fácil. Por favor, miren, estamos aquí, queremos que usted reciba esa ayuda. Tengan paciencia también, porque yo creo que el condado está haciendo mucho, el alcalde también. Estamos bien preocupados con los números que están subiendo. Por favor, síganos en las redes sociales, síganos aquí en la conferencia de prensa, y ya como él dijo, el otro lunes se va a abrir otra vez. O sea, una semana de hoy se va a abrir otra vez. Dios me los bendiga y muchas bendiciones.
Okay, if there are no other questions, we're going to conclude the press event today. Thank you very much, and look to our website for additional information about how you can access the CARES Act funding. Thank you for being here.